I'm going to assume that we've gone live. I'm Darcy Costello. Thank you for joining this Facebook Live with Mayor Fischer. Mayor Fischer, thanks for making the time to speak with us. Just as a reminder, if anyone has questions during this live stream, you can type them in the Facebook chat and I'll try and get to them. So I guess to start off, Mayor Fischer, last night I think Governor Beshear said that he was proud of how Kentucky had been doing. How has Louisville been doing in your view?
The same. I mean, we measure that by capacity we have in hospitals. We measure it by the goal that we set out at the beginning of this. And then, of course, we can compare ourselves to other cities, although this is certainly not a competition. But, what our goal has been all along was to limit the spread of the virus. And we know, and science shows us the best way to do that is stay at home and social distancing. And so people in Louisville have gotten used to that. And I got to say, I'm very proud of Louisvillians. I'm very grateful for their compliance during all of this. I know it's been really hard too. I know we're going to get to a better place, but people are kind of doing what it takes right now. So, look, we've had 36 deaths in our city, which is 36 too many. And each one of those, is very sad, especially we can't mourn and have our funeral rituals like we have right now. So that's bad. But we, compared to where we could be, we're just not right there. So I think what the main message to folks is we just have got to keep the faith in what we see is working, and that's that social distancing. If you have to go out for groceries, put a mask on. And the reason for that is really to protect other people from you. What we know is that there are people without symptoms, asymptomatic people, that are spreading the virus. So if you might have that and you're not feeling any of the symptoms of it at all, if you put a mask on, you won't be breathing or coughing, sneezing on other folks. So you could really save other people's lives when you do that. And there's a certain degree of protection for you as well when you have that mask on. So all in all, we're doing well. This is still a marathon. We're not into kind of releasing anything next week. And when we start releasing, we'll have to do that in a gradual fashion.
Got it. So I think a big question with Easter coming up on Sunday is how the city is going to respond to churches who have services. I think the last I'd heard was you were sort of asking people to obey recommendations. But what's the plan if you hear about a church or a large gathering? Is the city going to respond? Is law enforcement going to respond?
We'll be responding with information sharing. Really, what I'm appealing to here is just the goodness of people. We know that when we come together, that's when the increase for the infection spreading goes up, and then the risk for illness and death goes up. All we've got to do is look at Hopkins County. There was a religious gathering in Hopkins County that has now led to 54 people being infected and 6 deaths. And many of those people that have been infected now, they didn't go to the church gathering. So they have been infected by other people that went there. So I just think that, the main thing is this virus is no joke, right? And it doesn't care whether today is Good Friday or it doesn't care if we have a holiday. Its mission is to spread from person to person and infect them, and then that can lead to sickness. So as we look in, Passover that started 2 days ago, when we look at Easter, I mean, that the message in all of our religions is to love one another. And we can most love one another right now by staying physically apart from each other so we don't harm one another. So I know there's a tremendous desire to get together and worship like we have through every Easter throughout most of our lives in the Christian tradition. But this is a time in the year 2020 where we have to say, we have to worship it from home. There's so many different ways to follow worship services right now, whether it's the radio, whether it's the internet. So we don't have to be together to do that. I know that's our tradition, but our traditions are being disrupted right now by the COVID virus. So we again just ask everybody to stay home, be safe, worship at home. Don't have, and it really makes me sad to say all these things. Don't have your large family gatherings. I haven't seen my mom and dad now for 3 or 4 weeks. That's hard. Normally what would be happening, and I can remember when I was a kid growing up here, I come from one of these large Catholic families in Louisville. I mean, there would be like 100 of us together running all over the place, and our Easter finery that our parents would get us up, our moms would get us dressed up in, Easter baskets, Easter bunnies, and just total chaos, but that kind of loving chaos that families have when they get together. So it really hurts me to know we
Mhm.
can't do that, but we're going to have to show our love a different way this year. So have a virtual gathering. So that's the thing. I'm really just asking people to please do the right thing.
Got it. Um, and so I know you said that you send people to respond with like information sharing. Is it that LMPD like isn't going to yet start pursuing criminal charges? Is it that there's not really something they could be charged with? Is that just not what you want to be doing yet? Like, why not have a stronger response in terms of law enforcement, I guess?
Look, this is about appealing to people's better angels and doing the right thing. So LMPD will be handing out leaflets on related to the public health crisis we're in and the medical problems that come about when people come together. We don't want any showdowns with folks. That's what this is not about. Here's what I know. I know that 99.99% of Louisville churches, religious leaders are understanding and promoting social distancing, and they're doing it with a heavy heart. Nobody wants to do this, but they know in order to protect their congregants and the people and family around them, they have to do it. So I really appreciate that compliance. That's what leadership looks like, doing the right thing when it's hard, not just letting in to say, well, we'll stick it to the man or we'll show him who's the boss. That's not what this is about. It's about loving your family and taking care of them. So we're going to continue to hand out information and data and science and then hope people do the right thing.
Got it. Sort of on that note about the like 0.01% that might not be um, following the guidance. I think On Fire Christian Church had a drive-in service this week. It was like the day after you said don't have drive-in services. Um, I guess why not stop that from happening?
I, you have to weigh your actions to do what are you going to get the most and best result from when you take a decision. And what I've said before is, you know, the best way a society operates is when a society cooperates with each other. And when we co-produce a safe community, when we co-produce a healthy community. And so when you have, again, the vast majority of the community doing the right thing, I just don't think there's a benefit from making a show out of something else. And eventually, those folks, I think, will do the right thing because they'll look at like this Hopkins County tragedy, 6 dead because of a religious gathering, 54 infected. The science doesn't lie to us. And what we see with this virus is we don't understand the ramifications of poor behavior as it relates to social distancing until 2 or 3 weeks after these gatherings have taken place. And it could be a church service. You've seen the horribly sad story about the funeral gathering in Chicago and now the family up there that's just wiping out by the day. So, look, more and more people understand the issue. They're going to continue to understand the issue. We're going to continue to educate and communicate and trust that everybody will come along and follow the golden rule, like love one another. And if
Got
you
it.
do that, you want to stay away from each other.
Got it. And so switching gears from churches, I want to talk about nursing homes, which is another area across the country that have been kind of hotspots. And it seems like Trayton Oaks in Old Louisville has had a pretty severe outbreak. What's the administration's involvement in that been? I understand like 17 had been moved to Norton Health recently.
Yeah, that's correct. Yeah, the senior facilities are what started in the epicenter in Seattle in a senior
Mhm.
facility. And of course, that's been our big concern all along. One of the first things that we did was discourage people from visiting senior centers. Seems like a lifetime ago, but that was probably 3.5 weeks ago now, maybe. People were upset about that. And it's really understandable why you're upset about that because you've got a vulnerable loved one, typically in a senior care facility, that rely on you to communicate with them. And so they don't feel isolated and they're feeling that love in the latter stages of your life. And so people were upset with us for making this a requirement not to visit. But then that really within 24 or 48 hours went away because as people did the research, they said, my gosh, this is where most of the death, most of the infections are happening right now. So people came up to speed on that real quick. So now let's fast forward to the Trayton Oaks situation. Our senior care facilities and nursing facilities are overseen by the state. So we don't play a role other than as maybe some local assistance. In the case, what we did with Trayton Oaks problem is their staff at Trayton Oaks, the nurses, they started getting COVID positive. So they couldn't come to work. So the needs of the residents, the health needs of the residents at Trayton Oaks, they have three levels of care at Trayton Oaks, everything from independent living all the way down to a nursing facility. So we're talking about the nursing facility there.
Mm.
They didn't have the capacity to take care of their patients. So yesterday, 17 patients were transported to Norton on Broadway. We thank them for helping out here. And so that was three different ambulances services, the city, suburban fire, and private ambulance services,
Mm.
six different trips, ferried them over there. So they're now under the care of Norton's as they fight COVID-19. But again, I want to just remind everybody, uh, communicate with your loved ones in the senior facility through Facebook, through a phone call. You can go and, touch them through the window pane, give them some artwork, so that they know that you're there for them. But we got to keep our distance because that's how this virus spreads. And then also, once we start loosening restrictions in the city, we're still going to be very, very vigilant for our most vulnerable population. So that's our elderly, and that's those with chronic conditions. So there will not be a, just liberation of movement in and out of nursing homes until we get a vaccine, which is sometimes away, at least a year away. We're going to be having some kind of new normal in terms of how we move about our society.
Mm. Got it. Um, and I know that, the nursing home residents went to Norton. Are there any plans to create like other sites where infected nursing home residents will get treatments? I think we've seen other cities create kind of like special nursing home
Yeah.
treatment sites. Is that something you're working on?
Well, the whole strategy behind that is to isolate folks in nursing homes that have COVID virus, so they're away from the rest of the population, so it doesn't transmit. So I know individual nursing homes are working on that strategy internally to their facilities. I'm not aware of any different strategy than that right now. I know Eric Friedlander at the state has developed a group of experts that are advising him now on the next level of attention that should be paid to the senior nursing facility. So I would imagine this next week there'll be some more news about that from the state.
Okay, got it. And sort of on the subject of like healthcare, I saw WFPL reported this week that 10% of all Kentucky positive COVID cases were Jefferson County healthcare workers. So I'm wondering like how your administration is monitoring the number of healthcare workers getting sick and if there's anything you're doing or trying to do to help them fend off the virus.
Yes, absolutely. So, we're in daily contact multiple times a day with our healthcare system. So, our three main providers here, U of L, Baptist, and Norton's, and they're doing a really nice job. We're doing a good job communicating with each other, sharing data with each other so that we understand what our hospital capacity looks like overall with our ICUs, all different aspects of where the COVID virus would be treated. And that includes personnel also. So when we talk to our healthcare providers and we say, what is the constraint? What's your biggest concern in terms of fighting this disease? And it is making sure our healthcare workers stay safe. So that means they have to have the proper PPE, personal protective equipment, so that they can keep the virus from going from the patient to them. We're in relatively decent shape in the community with our PPE, so we're going to continue to source more of that to make sure our hospitals have that. But the real key on all this is just for everybody to continue their social distancing, because what we're seeing in our community compared to some other cities, the cities that are the most challenged, of course, are having a big spike in cases. And that's when you see on TV the images of the people lined up outside of hospitals, uh, the healthcare workers just being overworked and exhausted and mentally just to the breaking point because they're having to make decisions on who gets care and who doesn't get care. So that's what we've been working to and have been successful as a city so far in avoiding that. So think about what we're having in Louisville. Instead of a big peak, what we're having is just kind of a continuous plateau. So as people are released from the hospital, we have about that same amount of new people coming into the hospital. So we should really feel good about that locally because that means our stay-at-home strategy and our social distancing strategy is working so that we're keeping the virus from spreading to one to another.
Got it. So I know Governor Bashir has been pretty involved in trying to get PPE to Kentucky. Is that something that the city does, or is that mostly a state process?
No, absolutely. We're on that and have a dedicated team working on it every day. We're coordinating back and forth with the state. Unfortunate thing about this virus is it's exposed a lot of weaknesses from a federal standpoint. So normally what we'd like to see in a situation like this is a coordinated federal response, both with stay-at-home orders and then how PPE is distributed around the country. Right now, basically, cities are competing with other cities, states with states, private sector with the public sector. So as a result of this, it's just a very dysfunctional and overly expensive system that's in place. And so we'll have to diagnose this after this is all over. But it's very inefficient, and it means that it's just kind of a survival of the fittest as to whom can get any type of equipment right now, as opposed to what's the adequate baseline for everybody, and then what cities, what parts of the country are having the worst conditions. How do we give them more materials while others aren't
Mhm.
quite that far along? That should be orchestrated from a national level, but in this case, it's not. So hopefully we'll learn from this and be prepared in the future to make sure that does happen again. The other thing
Yeah.
that's happened to Darcy is the cost on PPE, because as a result of this national frenzy over trying to get it, is also now goes through the roof. So that means it costs all of us as citizens a lot more than it should cost. I'm disappointed in companies that are seeing this as an opportunity to massively inflate their prices. So,
Yeah.
like one instance in our N95 masks, the masks that you hear about that are so important. In the court, this was about probably 10 days or so ago. We had an order for 50,000 of them, I believe, at 97 cents. They called back and said, if you want them, they're now $3.50. We ended up getting 5,000, not 50,000. And then, of course, we hear reports now that some of those masks are going for up to $7 in New York City. That's horrible. So you've got people and companies profiting on the despair and death of other people in our country. And I think
Was that was a Louisville bid for the 50,000 that dropped down to 5,000?
yeah, yeah. But this is happening every day now, all over the country,
Right.
thousands and thousands time. So anyway, we've got to make sure as a country that we follow that we have the right federal protocols in place for emergencies like this so that we're all taken care of and that we only pay what we have to pay because you never know how much more you're going to have to buy, right? And
Right.
at the end of the day, this is a massive government relief program here, which is the only entity that's large enough to handle it. But the government obviously is us, the people, right? So we're paying for it like we have to because health comes first, but this has also resulted in a significant financial emergency for the city and for the country, as well as a social service delivery emergency.
Got it. Do you know, is there an estimate of how many days worth of inventory we have for like masks and 95s, other types of PPE?
Yeah, as of about a week ago, we were around 3 weeks or so supply. But that question assumes that we don't have a massive spike also.
Mhm.
So as I mentioned, we're on a nice manageable plateau right now. And absent us dropping the guard and doing things like everybody going to church services this weekend, which is not going to happen, thankfully, we're not going to see a big spike. And remember, the spikes show up later, so that we're fighting the spike so that we can manage the thing, wipe the disease out the best we can. And then as we loosen up our city and our country, We'll do that with folks that are healthy and ready to go out and about, and then just kind of monitor from there. We're going to have a new environment where we will be testing a lot more people when the tests become available, and then tracing folks so we understand who they've impacted. They'll need to still be isolated and quarantined until they go through their 2 week period so that we're really vigilant. What we've seen in some other countries now that, they've been through their peak, then they've released folks back into the community. Now they've had another spike. So
Hmm.
what we want to avoid is make sure we've got the discipline here so that we don't waste all of this good work we've done so far by dropping our guard, and then a spike comes, gets a lot of people sick, kills a lot more people. We're not going to have that here.
Got it. Earlier this week, I think your administration released some information about the racial demographics of coronavirus cases. I wanted to see if you had any updated data to share on that, and also why you think it's hitting some groups harder than others.
Yeah. The data I shared on Wednesday, it was no different yesterday in terms of the impact of this. So uh, the the mortality rate, the death rate of the coronavirus in Louisville is about the same as what our demographic population breakdown looks like. In other words, same percentage of white people we have in the community, which is around 68%. That's about the same percentage of deaths. It's about 70%. Our African American population, 22, 23%. Their mortality rate, I believe, is around 20% or so. So we are not seeing so far, I hope we don't, we're not seeing what we've seen in other cities where
Hmm.
the African American populations, the low income populations, are being significantly more impacted than the more affluent populations and usually the majority white population. So our sample size is low with 36 so far. Uh, so we just are going to have to continue to watch that. So why people ask, why is that taking place? Why is there more impact in our Black communities, in our low income communities? And not everybody that's Black is low income. Not everybody that's high income is white, et cetera. But these are just general things people take a look at. And we talk about the social determinants of health. What that means is where you're born, what situation you're born into, frequently is the biggest indicator of what your health outcomes are going to be as a person. And all over the country and cities all over America, there is a 10 to 12-year life difference between the least resourced citizens and the most resourced citizens. And by resources, I mean access to healthcare and education, good job opportunities. The less that your access is, the higher your risk factors typically are. The worse your health outcomes are. So if you already have poor health outcomes and you suffer from diabetes or a chronic heart condition, you're in a weakened state. You're in that vulnerable category we talk about with chronic conditions. So when a virus invades your body, you don't have as many defenses to fight that virus as somebody that's healthier than you. So as a result of that, the disease tends to be more deadly for folks that have these conditions. And unfortunately, these type of folks with these conditions are disproportionately represented in our low income and minority communities. So what I'm hoping is, and this is something we've been working on for the 9 years I've been mayor, is to increase the quality of life and access for folks that have been traditionally marginalized. This is a long journey because when you think about why people are in this situation today, this is the result literally of hundreds of years of systemic inequity in our country, of not resourcing our minority populations, not giving them the same type of opportunities and access than the majority white population has had. So that's just a matter of history and facts. And so I hope when we come out of this coronavirus pandemic, Americans will look at each other in a new way and say, look, we all need to have equitable access to the things that all of our families dream about, right? We want our kids to do better than us. We want our kids to have opportunity. We want all of our families to have shelter, food, and health care. We've got to reconstruct our systems in America to make sure that's available for everybody.
Is there anything to sort of do to address that disparity right now? Or is it really something you think like once we get out of this crisis, it's something people need to keep in mind and start addressing?
Well, you can always work on the problem now and build toward long-term solutions. Now, the challenge is all of the systems that have led to creating this problem have been in place for decades and centuries in many aspects of it. So, if you are right now uh, older, lower income, uh, diabetic, with a heart condition, that's hard to turn around, right? In the time that this pandemic is in place, you can start having healthier living or healthier diet, uh, starting your exercise. But it takes a while to get back, obviously, good shape, and then a lot of this are genetic challenges as well. So we can do that from the city standpoint. We can make sure that our kids have access to proper education, that our kids have access to proper physical health care, proper mental health care, so that our systems are all working together. That's what Evolve 502 does, to make sure that every child in our community has those wraparound services available to him or her. And then that you have no barrier to getting some type of post-secondary degree after high school. So that again is what Evolve 502 is all about in our community, because we know the number one disruptor of poverty is a post-secondary credential or a degree. And poverty is what leads to these poor health outcomes often. So we got to disrupt that through education, opportunity, and societal systems that fight poverty every chance we can.
Got it. I wanted to ask you about the unsheltered population. I saw that the CDC is recommending not clearing encampments during this time. Is that something the city's paused doing?
But we have paused that. We've also enhanced the day sheltering and night sheltering for our homeless population. The Salvation Army, I want to say thank you to them. They've been a tremendous partner on this, where we have increased capacity for 150 beds for men, for women. And then also we've stood up a facility for homeless that need to be isolated or quarantined. Thankfully, that's had very little use, anywhere from one person. I think that we've maxed it maybe at 4 people a night. So we've got the capacity in place for that. And then for homeless families, we have hotel vouchers for up to 30 days. Before then, we transition them to some type of housing solution after that, using some of the money that we have for Metro. So we've also installed in the city latrines and hand washing station, because in normal times, our homeless population, let's say, would use a restaurant's restroom or
Mm-hmm.
park or whatever it might be. With a lot of that being closed right now, they need a place to use the facilities and wash their hands. We're asking people to wash their hands. So you'll see those around the community also.
Got it. Cool. I think we're coming close to hitting our time limit. Are there final thoughts that you have or things you want to remind the community of moving forward?
Sure. Well, I appreciate the opportunity here with you, Darcy, and all the coverage that you're giving this COVID-19 crisis. And I just would like to say to the community that none of us 6 weeks ago would have said this is what our life's going to be like heading into the Easter weekend. So I just want to thank Louisville and say I'm proud and I'm grateful. You have all made sacrifices, and all of your lives have been disrupted significant way. But yet we all still have things that we can be thankful for, uh, starting with each other because of the social distancing that has been practiced in our community. Your fellow citizens that are doing that are helping to save your life and the life of those around us. So we're doing a good job as a city, and we just got to keep the faith as we move through this. We're going to get to a better day. There's no question about that. We're already seeing a lot of results from what we're doing right now. So that should give us great encouragement and great hope. So I just want to say thank you. We've got an all in strategy in our city. It is working right now, and we will pop out of the other side of this thing with a much better appreciation, I think, for each other. The economy will come back online, and we'll all get this through this together. So I just want to say happy Easter weekend to everybody out there. Happy Passover, and may God bless all of us as we continue to work through this together. So thank you.
Thank you. Thank you so much for the time, and thank you to the people who tuned in. We'll have more COVID-19 coverage on courierjournal.com. I'm Darcy Costello. Thank you very much.
Bye-bye.